In a group, someone had shared that they have degenerative disc disease. They just recently got the diagnosis. Doctor said that they're not a candidate for surgery, and there really isn't anything that they can do about it other than try to manage their symptoms, mainly through pain medication. My name's Desiree. I'm a licensed practical nurse, and we're going to get into it. So why does this even happen? I'm going to say something really quick about age and genetics. It is very common to pin a lot of symptoms and issues on age and genetics, but I like to point out that the number that you are or who your family members are do not guarantee that you're going to end up with any kind of complication or medical condition. So common causes. So if you happen to be doing a lot of bending, twisting, and repetitive movements over years and years and years, there could be slight little injuries that can occur here and there over time, eventually degenerating the back. Injury or trauma, this is going to be very obvious. So if you've experienced some kind of back injury, naturally we could potentially see some changes to the back leading to degenerative disc disease. And then we have lifestyle. So the idea is like if somebody's more heavy set, that's going to create a lot more compression and stress on the vertebrae and the discs in your back. Things like smoking can also impair your body's ability to receive the nutrients that it needs. Hydration is also a very big one. Again, our bodies are made mostly of water, and the spine is dependent on its ability to transfer fluid to the areas that it needs. Core strength, this is a major one. So if you're a person that has very weak core muscles, so basically the muscles around your torso, so not just your abdominals, but your obliques, and then in your back there as well. If these areas are weak, then that means that the spine is not supported adequately, meaning the vertebrae are going to take a lot of the stress. And when they take a lot of the stress, that puts the discs at risk. So what are some of the things that we can do? Ergonomic setup is important. So depending on what your job is, you want to be in a position where your back is getting all the support that it needs. So if you have a desk job and you have an awkward position, getting that addressed can really help compound over time. You're not going to the same motions every single day where it's putting all of this stress on you. Next is going to be weight loss. So for those that I have worked with that, were very heavy set at one point, that have lost, 25, 50 pounds, so on and so forth, the more that you're able to lose, the closer that you get yourself to a healthy body weight is going to take all of that extra load off of your spine, especially if your spine's already aggravated. So big success with that. Next, staying hydrated. So again, our bodies are made mostly of water, and so this is going to help deliver the nutrients to where it needs to go. Again, the discs in your back are made of mostly fluid, so the more dehydrated you are across your lifespan, the faster that's going to degenerate. Next, keeping your core nice and strong. This is very, very important. So the muscles around your torso, your hip stabilizers, so are basically the muscles around the top of your bum. Very, very important because that's going to help really support the spine, right? And for those that have been struggling to improve their spinal health through exercise, sometimes your musculoskeletal system is positioned in a way that, like, maybe you have muscle imbalances, maybe you have structure imbalances, and so addressing those muscle imbalance issues can be very helpful, and it can be very beneficial to see somebody like a physiotherapist or a sports medicine doctor that has a really good understanding of the body. Anti-inflammatory lifestyle, so consuming a diet similar to like the anti-inflammatory diet or the Mediterranean diet, so incorporating a lot of foods that have natural anti-inflammatory qualities in them, reducing your sugar intake because sugar is a very big inflammatory agent. Other things that are out there are things like acupuncture, acupressure, massage therapy, and chiropractor. Results may vary with these, but a lot of people do report some symptom relief. So I hope this video was helpful. Share it with somebody you know that might be suffering from this condition or might benefit from learning more about this. And come on by to Ask a Nurse to ask a question. When we all ask questions, we're all going to learn. Have a great day.